The information shared on CNS Unfiltered is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult your healthcare provider before making any health or lifestyle changes. The views shared are those of guests and do not necessarily reflect those of Innate Clinical Nutrition or its affiliates. This episode includes affiliate links, which help support the show. Most of my clients will come to me with a binder full of labs and a bag full of supplements and a deep frustration that no one is truly listening to them. They've gone to the doctors, doctor after doctor, being handed pills instead of answers or solutions, and being told that their labs are normal. I'm sure you can relate to this even yourself. And they feel far from it. They're looking for more than symptom suppression. They're looking for deeper testing, real explanations, and natural solutions to take control of their health again, not just another prescription to manage things indefinitely. So that's where a CNS nutritionist steps in. My job as a clinical nutritionist is to get personal, to be the detective, the strategist, the educator. We're trained to understand not only the biochemistry of the human body, but how it reacts to food, how it reacts to medication, how medications and foods react, and how to adjust the lifestyle to give results. We're designed to put this all together at a cellular level. We meet people where they are, and we help guide them from confusion to clarity, often bridging the gap between traditional and functional medicine. Because functional medicine is different, right? It's rooted in food. It's focused on the why behind the symptom, not just the what. And clinical nutritionists are often the foundation of this process, mapping out the root cause, optimizing the systems, and building personalized, evidence based plans that work. This is what I do in my practice. And this is why I created CNS Unfiltered. It is time that we showcase the brilliance and the depth and the integrity of certified nutrition specialists. It's time we take you behind the scenes, one real case at a time. Welcome to CNS Unfiltered, where certified nutrition specialists redefine healthcare. What traditional medicine overlooks, we uncover. Hi, I'm your host, Jena Salisbury, and I want to thank you for joining CNS Unfiltered's first podcast, the first podcast to highlight CNS's work in bringing the healing power of food into the mainstream medicine. So, I want to start this first episode by telling you why I'm here and why I think this podcast needs to exist. Because most people don't find a certified nutritionist first, right? They find us last. Usually after years of going in circles and seeing the doctors and getting handed more prescriptions and being told everything looks normal. But they don't feel normal, right? They're tired, they're inflamed, they're anxious, they're bloated, they're breaking down, and no one can tell them why. I'm sure you've been here yourself and you can relate, whether it's for you or your clients. By the time they reach the CNS, by the time they reach me with that binder and that bag of supplements, they're overwhelmed. They're checked out totally of the medical field. They don't want to see a doctor. So they're going to come see a nutritionist. They're looking for someone to make sense of it all and to give them something tangible that isn't another pill. And that's what I help them do. Honestly, it was me too. Ever since I was young, I had stomach pains. In high school, they got so bad that when I did dance and I ran track, I would be in so much pain. They would have me buckled over, and sometimes I couldn't even walk, and my mom would have to come into the locker room to help me get out. I was losing hair by the handfuls. When I would do testing, they would find blood or proteins or something in my urine. I had liver markers off. I saw a specialist. I had scopes, and I got no answers. None. I just learned to manage it, right? That's what we do. I learned how to live around my symptoms. But I also knew that we're given everything on this earth, and the body is telling me something's wrong. And so I needed to find a way to fix it one day, right? I do remember praying almost every night to be used as a tool to help heal people and to understand the body. I ended up at Western Michigan University and got accepted into their pre-med program. I was going to be a doctor until that first class, right? And it was all focused on pharmaceuticals. And I remember thinking like, is this the base of healing? Like this is what doctors learn. This is what I'm going to have to learn, and it didn't resonate. At the same time, I was working for adult foster care. And so I was managing their their care, right? So these clients were brain injured, and I would be the ones implementing their appointments, showing up to their appointments, implementing their care plans, and coordinating medications. Since it was a home setting, I was also in control of all of their food. So I started to wonder, right? What if I tried water for the headaches and the constipation before giving Tylenol? What if I supported their digestion and fibers before Dulcolax? And who would have thought it worked? I saw small changes, small shifts, more energy, fewer headaches, better mood, less fights in the bathroom. And, that's when I went to my advisor and said, I want to work with food. I want to work with preventative care. I want to work with the doctor, and I want to really be into healing. She goes, you want to be a dietitian? I said, a diet what? But, she was right. I pivoted into nutrition science and absolutely loved it. While the RD path was close, it just quite wasn't what I was looking for. By total divine alignment, I got a call from a functional office that I did not apply for. They found my resume, so somehow invited me in, and I knew it. That was it. So that office had already focused on bioidentical hormones and was a thyroid specialist. And we were starting to build a functional department. So my boss and I got to work. We expanded this functional department into gut programs, weight loss programs, brain health programs, IVs, peptides, and more. We built a functional medicine department from ground up. And through this process, I realized my gut still wasn't okay. Gut health became personal, and then it became professional. Over the past 15 years, I've developed programs. I've trained physicians and RDs and PAs and functional protocols and functional testing. I've helped hundreds of people get to the root of what's really going on inside their bodies. I've also worked with Nava Health to bring personalized nutrition and functional medicine into a larger clinical system. Working on that paradigm shift of medicine, right? Come along for the journey. Because now I want to bring it all to you. CNS Unfiltered is where we take you inside the real work of certified nutrition specialists and what we're doing every day.
This is exactly what I believe medicine should be. I was like, I'm going to end up being in functional medicine and helping people someday.
We'll walk through real client cases.
They were about 3 years old by the time they found me, and her rashes started. It was severe eczema, and this started when she was about 6 months old.
We'll explore the decision-making, the labs, the strategy, the trial and error, and the breakthroughs that didn't fit into that 15-minute doctor appointment.
When she was in my office, she was so emotional. And people, by the way, if you're going to become a CNS, people are going to cry in your office all the time. You're a therapist. Nutrition is sometimes just 10% of what you're doing in that session because eating is emotional, right?
If you're a CNS, a medical student of any kind, a practitioner, or a patient who's been dismissed and told it's all in your head, this podcast is for you. Because functional medicine isn't just a buzzword. It's not just clean eating, right? It is about clinical thinking. It is about knowing all these other modalities and understanding the body's systems and the process, and then how to meet that client where they're at to move them through to reach their goals of health.
Our goal is to help them feel better and live a more normal life. And we want them to eventually be on the broadest diet possible with the fewest symptoms.
And I don't use pharmaceuticals. So CNS Unfiltered isn't just about interviews. It's not another show filled with supplement talk or blanketed health advice. This podcast is here to showcase how CNSs think through real clinical care, how we assess root cause, how we use labs, how we pull from biochemistry, nutrition science, clinical intuition, and lived experiences.
My own health journey directed me in along a different path into the nutrition space, and specifically the functional medicine and functional nutrition spaces. So I, during college, became really sick. And ultimately, after a number of years of struggling, I was diagnosed with Lyme disease, along with a few other, co-occurring health concerns like SIBO.
In each episode, I'll interview fellow CNSs and walk through one real case from their practice, what that client came in with, what wasn't working in the conventional model, how they built the protocol, and what shift for that client.
Like, they only gave you the medication based on a TSH level, but I don't see a T4, a T3, any of the other markers. Go back to your doctor and ask them for it. She did. And the doctor raised an eyebrow. It's like, well, why is your nutritionist saying you should get these labs done? And she insisted labs were done, Hashimoto's.
So if you're a clinical nutrition specialist, if you're in training and want to know what clinical nutritionist really looks like in the real world, if you're a patient who's been dismissed, told everything looks fine, but you know something is wrong, or if you're a practitioner who's curious about functional testing, food-based care, and personalized protocols, you're in the right spot. We're going to release a new episode every week, and we're going to feature real CNSs working in the field. We're going to talk gut health, we're going to talk mold, we're going to talk yeast and Lymes and autoimmune cases, insulin resistance, hormones, inflammation, and so much more.
We're in a situation right now culturally of information overload. Too much information creates paralysis. So what do people do? They fall back on what they know and what's comfortable and what's familiar. So a lot of what we need to remember as practitioners in this field is less about transferring new data to the client as it is about curating and clarifying and simplifying what they already know.
Expect honest conversations. No gatekeeping, no fluff, nope, unfiltered. So whatever you think is important right now, and this is bringing it all together. So go for it. Just real insight from practitioners who care. Occasionally, I'll be doing solo episodes like this one. But there, I'll be breaking down my own journey, my children's health journey, answering questions, unpacking case themes that I see across in my personal clients. Thank you for listening to this very first episode of CNS Unfiltered. If this resonates with you, hit follow or subscribe so you never miss an episode. Share it with your fellow CNS, a student, or a practitioner who needs to hear what real clinical nutrition looks like. And if you're a CNS doing meaningful work in the field and you want to be a guest, reach out. We are just getting started.